Hello, everyone. Welcome to the COVID-19 Health and Medical Podcast Series. I'm Dr. Till Jolly, Chief Medical Officer of Aveshka, and I'm pleased to be working as chair of the Medical Task Force for the Innovation Institute for Fan Experience, which is focused on key health and medical issues from the global sports and entertainment industry's perspective, especially in the era of COVID-19. Our weekly podcasts are aimed to bring you up to the minute insights from leading experts on the health and medical aspects of sport and entertainment. This podcast series will unpack the latest in critical issues such as COVID-19 vaccination, treatment, reopening, and testing that affect the sports and entertainment industry and, frankly, all of us. This podcast series aims to help the sports and entertainment industry and all of us return to work, play, and spectate safely and effectively. Importantly, this podcast is being recorded in the second week of March 2021. I say that because information about COVID-19 is evolving very rapidly, and this series will be updated on an as-needed basis. In this episode, we will focus on the important issue of mental health in our youth, really a growing crisis that we don't talk about nearly as much as we should, and talk about the importance of sports and activities and athletics in the lives of our kids. We're very pleased today to be joined by Dr. Molly O'Shea. Dr. O'Shea is a pediatrician and practice owner of Birmingham Pediatrics in Michigan for 30 years and a former journal editor with the American Academy of Pediatrics Prep Audio. She's a writer, a speaker, a parent coach, consultant, and the official pediatrician of the Goldfish Swim School nationwide and On My Own of Michigan. Dr. O'Shea is really a recognized expert in the health and welfare of our kids, and welcome, Dr. O'Shea. Thank you for being with us today.
Thanks so much. I'm very pleased to be here and talking about this issue. Kids all over the country and all over the world have really been dealt a rough hand of cards with COVID, as we all have, and I think now that we can see the light at the end of the tunnel, it's great to be talking about how to get kids' mental health back on track.
So let's start the conversation first with just your general impressions of what has happened in the past year related to the mental health of our kids. We know the resources weren't perfect or even close to it before, but on multiple ends of the spectrum, really, what have our kids been facing?
Yeah, it's been a rough year. It's been a rough year for all of us. And if we think about it in the format of, if you had a great family to start with and you had a lot of support around you, the challenges that were faced with lockdown and isolation could be buffered by that structure that you had around you. But children, especially children who are already met with other stressors like poverty or dysfunctional families, were under even more stress. So if you look at the statistics around mental health in the time of COVID, about twice as many children sought help in the medical system for mental health issues in the early months of the lockdown compared to the same time the previous year. In contrast, only about half as many kids went to the doctor for any other reason. So it really was at the beginning a huge, huge stressor for children of all ages. Looking at substance abuse, looking at overdosing, those numbers were even higher, and especially so for children of color. And I don't know if that reflects those added stresses, because a lot of our families in the United States who are represented in those areas of color are also more apt to be in poverty and have other stresses in their lives. And so turning to other ways to feel better, almost self-medicating with drugs and other substances, was a coping mechanism for them. So there's no question that COVID has had a huge, huge effect on the mental health of our kids.
So you really touched on a lot of issues there that we probably ought to unpack a bit. And I think, across all age ranges and across kind of the continuum of what such problems are. You talked about the statistics, and whatever you look at, whether it's, insurance claim statistics or surveys or what we hear from our school administrators, every statistic bears out what you said, which is that there's a range of problems for all of our kids. Let's kind of start with the kids at the younger age ranges in the developmental. I mean, you hear anecdotes, even things, the physical contact and the socialization for preschool and early elementary school kids. Really, I think I don't necessarily expect you to know exactly what's going to be the result of that in 5 years, because I don't think anybody really knows. But what are your thoughts on that?
I remember when we were first having discussions around this, when kids were being pulled out of daycare and then going back in. And I remember being concerned about the fact that all of these preschoolers were going to be encountering adults in their world with masks on, and that their whole social experience was going to be for 8 hours a day if they were in daycare full time, or maybe 10 hours a day with adults who they were only going to see their eyes, And how was that going to affect their social emotional development? The jury's out, right? We don't have the data yet on that. We do know that children in cultures where there is elaborate covering of women's faces do develop normally in social emotional ways. So there is encouraging information to hope that that will still happen in a normal way. But I do think that the stress attached to that re-entering into what is a social environment with caregivers is going to add to that experience. And it's uncertain right now. It really is unclear what those outcomes are going to look like for kids. The thing about young kids, though, is that they take their cues from the adults in their lives. Their social and emotional health is almost entirely determined by how the adults in their lives respond to them and how they carry themselves. So if the adults in their lives are calm, happy, generally not anxious, not depressed, they are going to fare very, very well. But if they are encountering in their world adults who are very anxious, uncertain, fearful, or depressed, it's going to color their view of the world. So COVID isn't just about how are those kids going off to daycare with the adults in their lives with masks on, but it's also about the fact that all the adults in their lives have been dealt a very uncertain world.
That's an important point. And I think as we think through, our IAFX audience and other related audiences, they're concerned with how to get the teams back on the field and how to get their arenas and stadiums back to some level of population. But many of them and us have families, and this is important individual advice for parents who will be watching this. I think, we used to get questions, and we still do, is it safe for our kids to go out and play?
Right.
Because parents wonder, they hear all sorts of things. What are your thoughts on the importance of just play? Forget organized sports for a second, but just going out and interacting and playing outside.
Right. I think that's a great question. And the good news is all along we've come to learn more and more about COVID is that children of all ages, including adolescents, are less apt to spread COVID than adults. Children, the younger you are, the less able you are to spread COVID. The older you are, the more apt you are to spread it. But children of all ages are less apt to get severe illness from COVID. So I'm a practical parent, right? I raised kids to adulthood, and frankly, having them around in the house all the time, that's challenging. So I really do think kids should be encouraged to go outdoors and play. I think they should wear masks, but I don't think that having them indoors cloistered up all the time is healthy for anybody. So yes, have them go outside, have them play with each other, kids of all ages. For the older kids who are teenagers, who are more apt to be a little bit more rebellious, less apt to listen to you as a parent telling them what to do, I do think trying to encourage them to wear masks and, to be careful is important to emphasize. But they too should be allowed and encouraged to be out in the world with their peers in a careful way.
It's so important to people with families and the people that are around kids. And now in the second week of March, schools are starting to talk about going back into schools. And there are differing ranges of which schools are going back and what the population numbers, but just your general thoughts on the importance of being in school and school activities for kids and what that means versus the online environment that we've all gotten used to.
Online learning is terrible. I mean, I really think there is just no other way to put it. It's not for the lack of effort and the commitment of the teachers. They are awesome and they are doing everything they can to make that online learning experience valuable for kids. But learning is social. We all learn from each other, whether we're actively writing down things together, but or not. That's not really the point. We learn best. Sports is the most fantastic example of how learning happens in a social environment. We learn best as a group. We're social people. So to take learning and put it, especially for children, in a solo environment really creates an environment where learning becomes much harder. So, for all kinds of reasons, for the social emotional growth that happens in the classroom and in school beyond just the rote academic learning, for the kid who might need the meals at school, who might need the support of a teacher because their parent is overly stressed out, who might need that connection with a friend to give them that pat on the back or that other opinion about something in their life. There's so much more that takes place at school than learning. But even the learning component of school is better done in the classroom. So whenever it can be safe, and I think the CDC recently came out with some fantastic framework to help schools determine when it is safe to come back in person, I firmly believe that needs are much better met in the classroom than out of it.
You mentioned the pat on the back, and I think, and you mentioned sports, which are very important for you know kids in certain environments. They get plenty of support at home. They have you know stable family environments. They have plenty of resources, but there are many kids that don't, more than we even realize. And you hear many stories, and we've all, as we relive our youth and our athletic prowess we didn't really have, the ability of coaches and team managers, and either in school sports or in organized youth sports or in little league or youth soccer or whatever it is. I think coaches can have a really outsized influence on kids' development. Your thoughts on those other outside school leaders?
Well, I think sports have taken on, and I agree with you wholeheartedly that these other adults in children's lives at all ages can have a life changing effect on some kids and on all kids who experience the joy of sports. It teaches all sorts of important things in life. It teaches you that you can make a mistake and recover. It teaches you that you don't have to be perfect. It teaches you that even though you've let your team down, your team will still accept you. There are all kinds of lessons that sports teach that are essential to becoming a functional adult. Most of us who played sports as kids, and I was a real sportsy kid myself, don't go on to be adult athletes in a competitive way, but it did prepare us to take risk in our adult life, to be authentically ourselves, to be unafraid to make mistakes. And I think that's a really important part of sport. But even more so now, I think that children don't have as many opportunities for unsupervised sort of playing with the kids in the neighborhood. So, because of parental fear now of the world, kids really their best opportunity for collaborative experiences is through sport, frankly, and when they're younger. And the opportunity for having an adult outside the family that they can gain that trust with, that they can have someone else that they can rely on, and that they can share important things with, bare their soul to if they need to, is huge. And for some kids, it is life saving.
Yeah, that's such an important point. I think also I'd like to focus a little bit more as we move up in the age ranges. The younger kids have their own stresses. It's clearly the online learning and the environment they're now experiencing is odd at best, and certainly problematic. As we get up into middle school, we all know that the middle school age ranges, sort of sixth to ninth grade, depending on the state you live in. Is a tough time for kids. Girls and boys developing at different rates, sort of exploring their understanding of the world, exploring where they fit in and where they think they don't fit in. And that is probably contributing to some of the stresses that you spoke about when you talk about statistics of serious mental illness and stresses on our healthcare system. How do we advise parents and leaders to begin to, one, deal with the problems we have now related to the mental health of those age ranges, sort of the early adolescence, and then any advice on how do we get them out of whatever this is in the coming years?
Yeah, the middle school and early high school years are they're a mess, man, for every kid. We've seen it as parents and our own children, and we experienced it ourselves, as people becoming adults, right? And I think it's the pandemic has really amplified some of that sort of self awareness and self focus that those years present. Before, you used to be able to go to school and you would have the opportunity to try out your new personality, give it a try, see how it floated, and come home and say, well, that didn't work, and maybe try something else. And at home, all you can do is sort of ruminate over yourself, and then have social media to amplify your imperfections or your bad qualities, as opposed to going in person, IRL, in real life, and see that you aren't the only one who's imperfect. So it's really been difficult for middle schoolers, especially, and early high schoolers, to figure out that they are perfectly imperfect, as we all are. I think as kids return to school, it's going to make it's going to balance things out a little bit. Those kids who have kind of spiraled into that hole of self hatred or self doubt or whatever are going to begin to crawl out, just because they will re-enter reality and be able to see the world more clearly. But for some kids, they're so deep in that hole that it's going to be hard to climb out without somebody throwing them a rope and giving them something to hang on to. And for those kids, having some professional help is going to be essential. Many parents have already sought out help for their kids, and some have been able to find it, and some have struggled to find it because of the gaps in our healthcare system around mental health. But I do think, finding a group of kids, parents can kind of convene a group of kids, trying to find an interest, a group, a sport, a club, a youth group at church, something that can kind of move your child out of their internal mental self and into the world, can help mitigate a lot of those feelings.
Yeah, that's an important. I think getting some help is important. As you mentioned some of the problems, and we really would be remiss if we didn't mention really some of the serious problems that families, as the kids get older and become essentially young adults, are facing related to drug abuse, addiction, potential suicide, and obsessive compulsive disorder and depression, and all the things. I think that sometimes lie under the surface, and parents, I think, don't realize. Among the things I've learned during this in outside work is the degree to which our school nurses are essentially the mental health safety net. And about half of their work sometimes is on mental health of their students, and they may be the only resource they have. I think advice I would give, and then I'll ask you for
Yeah.
yours, is for parents to really not be afraid to seek help and realize that they themselves are under stress. They're in abnormal environments, regardless of their economics or anything or their work circumstances, and their kids are really under stress and need an outlet. And sometimes the outlet may not be the parent, but if you see signs, those signs are probably real. And seek help, whether it's from a mentor of some kind or a school resource who are still there, just perhaps remotely, or even a hotline, or suicide or other hotline that might help. Your thoughts on that?
Oh, well, without question, that is absolutely true. And I think that there's a difference between a kid who's moody and sad because they can't be with their friends and a kid who's withdrawn from all aspects of life. And so if as a parent, if you see a kid in your home who is opting not to talk to you because you're their parent and you annoy them, and a kid who has withdrawn from talking to all their friends, who really you have struggled to get them out of bed even to um, you know, go on an outing with their friends, that's a whole different story. And without question, don't be afraid to ask your child, are you thinking of harming yourself? Do you feel like you want to live or die? Are you thinking about killing yourself? Don't be afraid to open that question. You won't plant that seed in your child's mind. You don't have to worry that that's something you will have done. It will crack open the opportunity for your child to share their thoughts and feelings. And to build on what you were talking about too, the old, you have to put on your own life mask before you can help anyone else. Parents need help too, and it's very difficult to support a child who is in difficult need of help if you yourself are at your wits end. So by all means, um, parents should seek help as well. So that's where mental health support is absolutely valuable, without question. And it's exhausting to try to find it. And parents who are already suffering with some of the mental health challenges that their kids are, you know they call the first place, there's no openings. They call the second place, they can't get in, and they give up because it's exhausting to try when you are tired and you are depressed. And but that persistence is so important. And you can get people to help you. You can get your child's pediatrician to make those calls for you, or you can ask a trusted friend or relative to help you get that help.
Very important advice, and I want to echo what you said, particularly about asking questions. As physicians, you and I have probably asked those questions very directly, hundreds or thousands of times, to patients, and it's very uncomfortable the first few times you do it because you're asking a very personal question, and we're discussing parents asking very probing questions to their kids, but sometimes just asking the question or asking a question and letting a child talk will bring out the important aspects. And I think that advice is if people take nothing else from this, listening to their kids and bringing up tough issues will engender probably a very productive conversation. And it may take a few times, but we all have to realize we're in a stressful time.
Well, and one of the greatest pieces of advice I got, and now I share with every other parent I ever talk to, is your kids don't want you to solve their problems. They want you to listen to them. So if you can, instead of saying, why don't you just go call Joanne, or why don't you just go out and shoot hoops? Instead, if you say to them, you seem really sad. What do you think could help you feel better? And when they say, well, I don't know, say, I really, think about it. Let's talk about it, figure that out. I think is much more valuable to your teen because they understand that you care about their feelings and aren't trying to solve their problem.
That's great advice, I think. And in those upper age ranges, we're starting to see, as with the lower age ranges, schools starting to reopen, activities starting again. Um, a word about again about the value of sports and just athletics, and not even necessarily formal sports, but activity in all of our lives. But at those older ages, we worry now about the big sports. We're hearing about Major League Baseball and other things, but that's getting the news. But your thoughts on the importance in kids of getting back to competition or just friendly sports?
Yeah, so physical activity has a big effect on mental health. And so whether you're playing for a team or whether you're playing intramurals or whether you're just going for a run or doing yoga in the basement of your house, being physically active has a definite benefit and a mental health boost. So it's clearly, if you can muster it, right? If you're feeling good enough that you can muster up the energy to do it, it's going to help you feel better. And for those kids who are already inclined to play sports, it's a great way to reconnect with other friends. It's a great way to not have to have big conversation, but get camaraderie. So I think it's a terrific way to sort of re-enter the world. A lot of teens are nervous actually about re-entering the world. They've kind of been in isolation for a while. They've developed a little bit of anxiety, and especially those kids who are a little bit more reserved, this reentry is going to be a little bit challenging for them. So doing an activity, sports is a great example of that, is a way to break the ice where you don't have to make small talk. You know, the activity provides the way for you to reconnect. So it's a great way to do it.
That's great. And I'm going to ask you for some closing thoughts on what the big things you want people to know as we deal with essentially a year into the worst public health crisis in a century, and how we're going to look at not suddenly turning things on and off, but over a period of probably years, getting us back to, I hesitate to even use the word normal, but something that's more functional and happier and more healthy for all of us, particularly our kids. Your thoughts?
Like all things that are huge events in our lives, we aren't going to go on to that next stage in our lives without having it change us in some way. And we can look at the pandemic time, this year plus that we've spent, and take away the good things from it too, right? Because there are good things that happen. We did get to spend more time on ourselves and with our families. And what did we learn about ourselves from there? So, as teens in particular, and as individuals, as we move ahead with our time, I think we need to be more aware of where our strengths are, where our weaknesses are. We can begin to understand much better how to ask for help and when we need to ask for help. And especially for teenagers and parents of teenagers going forward, don't be afraid to ask for help. I don't expect that as soon as the doors to the school open and, the arenas all get full again, that we're all going to feel normal. We're not. This is going to have an effect on us for a long time. So when you feel not quite right still a year from now, don't worry that you aren't normal. It's okay. This was a big thing, and you can mourn the loss of this year for a long time, and you can honor that, and it's okay. But I think you can also recognize that you can still move forward in a way that honors this year by learning from it and recognizing the things about yourself that grew stronger in it too. And I think that sort of lesson that we talk about with our kids and share with them will help them grow from it rather than just be kind of crumpled from it.
Great insights and great points. I think important for parents and for members of communities and for kids and for leaders in multiple industries, sports, entertainment, and otherwise. I think those are, and I want to thank you. This has been an outstanding session, outstanding advice. Really, every parent should hear this. So thank you, Dr. O'Shea, for the time with us today. I'd be remiss if I didn't point out that you can find out more about Dr. O'Shea's important work at drmollyO'Shea.com, publications, speaking, and other things, really putting out important information for all of us. Thank you again for your insight and contributions.
Thanks. I've had a great time. Yeah, it's been fun.
Really outstanding, and you will be back, hopefully.
Great.
And I want to, on behalf of Aveshka and the Innovation Institute for Fan Experience, I want to thank you for taking the time to listen today to this important subject. In the coming weeks, we'll be discussing other issues related to COVID-19, including testing and reopening of venues. And next week's edition will feature a discussion on important issues related to vaccination, a major issue facing the nation. For more information on Aveshka and IIFX, you can visit us at www.aveshka.com and www.iifx.org. And to get more information about both this series and other important issues. Until next time, please continue to stay safe. Thank you.